Question 1. Which of the following is considered an absolute contraindication for massage therapy? A. Mild muscle soreness. B. Localized chronic pain. C. Fever. D. Stress and anxiety. Answer: C. Fever. This question tests your knowledge of contraindications, which are conditions that make massage unsafe or inappropriate. A key clue is absolute contraindication, meaning massage should not be performed at all. Fever indicates an active infection or inflammatory process, and massage could spread the infection, worsen the client's condition, or overtax their system. For example, massaging someone with a high fever could lead to increased discomfort or even a more serious health issue. Always remember that a fever is a sign the body is fighting something serious, so it's a clear signal to postpone the massage. Question 2. What is the primary purpose of client intake forms and interviews? A. To gather marketing data for future promotions. B. To determine the client's financial stability. C. To identify contraindications and develop a safe and effective treatment plan. D. To record the client's personal opinions about other massage therapists. Answer: C. To identify contraindications and develop a safe and effective treatment plan. The core concept here is the crucial role of the client intake process. The phrase primary purpose indicates you should focus on the most important reason for conducting this initial assessment. Intake forms and interviews are essential tools for gathering a client's health history, understanding their current condition, and identifying any medical issues or medications that might contraindicate massage or require modification of techniques, ensuring a safe and beneficial session. For instance, if a client reports deep vein thrombosis, DVT, in their intake, you know that area is an absolute contraindication. Always remember that thorough intake protects both the client and the therapist by guiding safe practice. Question 3. Which massage technique involves long, gliding strokes typically applied with the palm or fingertips, often used to warm up tissue and assess client response? A. Petrissage. B. Effleurage. C. Tapotement. D. Friction. Answer: B. Effleurage. This question focuses on fundamental Swedish massage techniques, specifically identifying a stroke by its descriptive characteristics. The keywords long, gliding strokes, and warm-up tissue are strong indicators. Effleurage involves smooth, flowing movements that prepare the tissues for deeper work, spread lubrication, and help the therapist assess the client's body. An example is using slow, broad strokes along the client's back at the beginning of a session. Always think of effleurage as the foundational stroke that helps you connect with the client's body and initiate the massage. Question 4. When performing massage, proper body mechanics are essential primarily to A. Increase the amount of pressure that can be applied. B. Prevent therapist injury and enhance technique effectiveness. C. Reduce the amount of time required for a session. D. Impress the client with your physical strength. Answer: B. Prevent therapist injury and enhance technique effectiveness. This question addresses the critical concept of body mechanics in massage therapy. The term primarily highlights the most significant reason for proper technique. Good body mechanics involve using your entire body weight, maintaining a stable base, and keeping a neutral spine, which distributes effort and reduces strain on individual joints, protecting the therapist from repetitive stress injuries while allowing for deeper, more sustained pressure. For instance, leaning into a stroke from your core rather than just pushing with your arms saves your wrists and shoulders. Always remember that protecting your body ensures a long and healthy career. Question 5. Which muscle is primarily responsible for shoulder adduction and internal rotation, often targeted in desk workers with rounded shoulders? A. Deltoid. B. Latissimus dorsi. C. Biceps brachii. D. Trapezius. Answer B. Latissimus dorsi. This question tests your anatomical knowledge, specifically regarding muscle actions and common postural patterns. The clues shoulder adduction and internal rotation, along with the reference to rounded shoulders, point directly to the function of the latissimus dorsi, a large muscle of the back. This muscle pulls the arm towards the body and rotates it inward, often becoming tight and contributing to a forward shoulder posture in individuals who sit for long periods. For example, when you pull something toward your body, the latissimus dorsi is actively engaged. Understanding muscle actions helps you effectively target tissues that contribute to postural imbalances. Question 6. A client reports a new, unexplained bruise on their arm during a session. What is the most appropriate action for the massage therapist? A. Apply deep tissue massage directly to the bruise to help it heal. B. Ignore the bruise and continue with the planned massage. C. Document the finding and avoid direct massage to the bruised area. D. Ask the client extensively about the cause of the bruise, demanding a detailed explanation. Answer C. Document the finding and avoid direct massage to the bruised area. This question pertains to client safety, ethical practice, and contraindications. The key phrase, new, unexplained bruise, indicates a potential local contraindication and a need for careful observation without judgment. While you should note the bruise, asking for extensive details can be intrusive. The focus is on client safety. Massaging directly on a bruise can cause pain, worsen tissue damage, or indicate an underlying issue that massage could exacerbate. Always document any significant findings, avoid the area, and consider referring the client to a medical professional if the bruise seems concerning or if there are other signs of injury. Question 7. What is the term for the ethical principle that requires a massage therapist to protect a client's private information? A. Beneficence. B. Non-maleficence. C. Confidentiality. D. Justice. Answer C. Confidentiality. This question assesses your understanding of ethical principles in massage therapy practice. The core concept is about protecting private information. Confidentiality means keeping all client information, including health details and personal discussions during sessions, private and secure unless legally required or with explicit client consent. For example, discussing a client's condition with a family member without their permission violates confidentiality. Always treat client information with the utmost respect and privacy to build trust and maintain professional boundaries. Question 8. Draping during a massage session serves which of the following purposes? A. To allow the therapist to observe the client's entire body at once. B. To keep the client warm, ensure privacy, and maintain professionalism. C. To demonstrate the therapist's skill in manipulating fabric. D. To make the massage table more comfortable. Answer B. To keep the client warm, ensure privacy, and maintain professionalism. This question addresses the fundamental practice of draping in massage therapy. The concept tested is the multifaceted purpose of draping. Draping is about far more than just covering the client. It ensures their modesty and comfort, maintains their body temperature, and reinforces professional boundaries and ethical conduct. For example, using a top sheet and proper draping techniques ensures that only the area being worked on is exposed at any given time. Always remember that effective draping builds client trust and contributes significantly to a safe and professional environment. Question 9. Which of the following conditions typically presents with localized inflammation, swelling, and pain, and requires a modification of massage techniques, possibly avoiding the area? A. Chronic fatigue syndrome. B. Tendinitis. C. Fibromyalgia. D. Scoliosis. Answer B. Tendinitis. This question tests your ability to identify common pathologies and how they influence massage application. The keywords localized inflammation, swelling, and pain are classic signs of an acute localized inflammatory condition. Tendinitis is the inflammation of a tendon, often due to overuse, and while massage can be beneficial in chronic stages, acute tendinitis requires gentle techniques around the area or avoidance to prevent exacerbating the inflammation. For instance, deep friction directly over an acutely inflamed Achilles tendon would be inappropriate. Always remember that acute inflammation is a red flag for direct, vigorous massage, and often requires gentle, indirect work or referral. Question 10. How long should a massage therapist typically wash their hands between clients? A. 5 seconds. B. 10 to 15 seconds. C. 20 to 30 seconds. D. 1 minute. Answer: C. 20 to 30 seconds. This question addresses essential sanitation practices, a cornerstone of professional massage therapy. The concept is about proper hand hygiene to prevent the spread of germs. Washing hands thoroughly for 20 to 30 seconds with soap and water, covering all surfaces, is the recommended standard by health organizations to effectively remove transient microorganisms. For example, humming the Happy Birthday song twice can help you time your hand washing. Always prioritize diligent hand washing before and after every client contact to ensure a safe and hygienic environment for everyone. Question 11. What is the primary benefit of applying heat, such as a hot pack, to an area before massage? A. To constrict blood vessels and reduce swelling. B. To increase muscle tone and rigidity. C. To increase circulation, relax muscles, and improve tissue pliability. D. To numb the area for deep tissue work. Answer: C. To increase circulation, relax muscles, and improve tissue pliability. This question explores the therapeutic effects of hydrotherapy, specifically thermotherapy, heat application. The keyword primary benefit directs you to the main physiological effect. Applying heat causes vasodilation, meaning blood vessels expand, increasing blood flow to the area, which helps relax tight muscles and makes the tissue more pliable and receptive to massage techniques. For instance, a warm moist towel on the shoulders can significantly ease tension before you begin effleurage or petrissage. Remember that heat prepares the tissues, making them more amenable to your touch. Question 12. A client experiencing severe, acute low back pain with radiating numbness down their leg should typically be A. Encouraged to receive a vigorous deep tissue massage to work out the pain. B. Advised to self-medicate with over-the-counter pain relievers. C. Referred to a medical professional for diagnosis and treatment. D. Told that massage is not effective for nerve pain. Answer: C. Referred to a medical professional for diagnosis and treatment. This question highlights the importance of recognizing red flag symptoms and acting within your scope of practice. The keywords severe, acute low back pain with radiating numbness suggest a potential serious neurological issue, such as a herniated disc or nerve compression, which is beyond the scope of a massage therapist. In such cases, the priority is a proper medical diagnosis to rule out serious conditions. For example, attempting to massage a client with undiagnosed radiculopathy could worsen their condition. Always remember to refer clients exhibiting signs of serious medical conditions to appropriate healthcare providers. Question 13. Which action would be considered outside the scope of practice for a licensed massage therapist? A. Performing a Swedish massage to reduce stress. B. Providing nutritional counseling and prescribing supplements. C. Applying hot stones as part of a therapeutic session. D. Educating a client on basic self-care stretches. Answer: B. Providing nutritional counseling and prescribing supplements. This question tests your understanding of the professional boundaries and limitations of massage therapy. The phrase outside the scope of practice means actions that are legally and ethically beyond what a massage therapist is trained or licensed to do. Nutritional counseling and prescribing supplements are functions of other licensed healthcare professionals, such as dietitians or medical doctors. For example, while you can suggest hydration, you cannot diagnose a nutritional deficiency or recommend specific vitamin dosages. Always remember to stay within your professional boundaries to ensure client safety and maintain your licensure. Question 14. When designing a treatment plan for a client, the therapist should primarily consider A. The therapist's preferred techniques and schedule availability. B. The client's goals, health history, and identified contraindications. C. The latest massage trends and social media popularity. D. The potential for the longest possible session duration. Answer: B. The client's goals, health history, and identified contraindications. This question focuses on client-centered care and the process of creating an effective massage plan. The key phrase "primarily consider" emphasizes the most important factors. A successful treatment plan must always be tailored to the individual client, taking into account their specific reasons for seeking massage, any medical conditions or medications from their health history, and any areas that should be avoided or modified due to contraindications. For instance, if a client wants stress reduction, the plan would differ significantly from one for a client recovering from a muscle strain. Always remember that the client's unique needs and safety are paramount in planning their session. Question 15. Which of the following is a key characteristic of professionalism for a massage therapist? A. Maintaining strict personal boundaries and ethical conduct. B. Sharing personal problems and opinions with clients. C. Frequently canceling appointments due to personal reasons. D. Dressing in casual clothing and flip-flops. Answer: A. Maintaining strict personal boundaries and ethical conduct. This question assesses your understanding of professional standards in the massage therapy field. The concept of professionalism encompasses various behaviors, and key characteristic points to a foundational aspect. Professionalism includes consistent ethical behavior, respecting client privacy, maintaining clear boundaries, and upholding the integrity of the profession. For example, never discussing a client's personal life with others, or maintaining appropriate physical and emotional distance, demonstrates professionalism. Always remember that professionalism builds trust and ensures a safe and therapeutic environment for your clients. Question 16. What is the anatomical term for a band of fibrous connective tissue that connects muscle to bone? A. Ligament. B. Cartilage. C. Tendon. D. Fascia. Answer: C. Tendon. This question tests basic anatomical terminology related to connective tissues. The crucial phrase is "connects muscle to bone." Tendons are strong, cord-like structures that transmit the force of muscle contraction to the bones, enabling movement. For example, the Achilles tendon connects the calf muscles to the heel bone. Always remember that tendons are the connectors between muscle and bone, while ligaments connect bone to bone. Question 17. When documenting a client session using the SOAP notes format, which section would include objective observations made by the therapist, such as palpated tissue texture or postural deviations? A. Subjective, S. B. Objective, O. C. Assessment, A. D. Plan, P. Answer: B. Objective, O. This question tests your knowledge of SOAP notes, a common method for documenting client sessions. The concept of SOAP notes helps organize information for clear and concise record keeping. The objective section is where the therapist records measurable and observable data, like range of motion measurements, specific areas of tension found upon palpation, or visual assessments of posture. For example, noting hypertonicity found in bilateral upper trapezius would go into the objective section. Always remember that objective means what you observe and measure, not what the client tells you. Question 18. Which of the following is a common physiological effect of general massage on the circulatory system? A. Decreased blood flow. B. Increased heart rate. C. Vasodilation and improved lymph circulation. D. Lowered blood pressure immediately after strenuous activity. Answer: C. Vasodilation and improved lymph circulation. This question focuses on the physiological effects of massage on body systems. The phrase common physiological effect asks for a typical biological response. General massage, particularly strokes like effleurage and petrissage, promotes vasodilation, widening of blood vessels, which increases blood flow and nutrient delivery to tissues, and also enhances lymphatic drainage, helping to remove metabolic waste. For instance, the skin often appears flushed after massage due to increased local circulation. Remember that massage supports the body's natural processes of healing and waste removal through improved circulation. Question 19. What is the primary reason for obtaining informed consent from a client before a massage session? A. To ensure the client pays for the session. B. To allow the therapist to perform any technique without question. C. To respect the client's autonomy and ensure they understand and agree to the treatment plan. D. To protect the therapist from all legal liability. Answer: C. To respect the client's autonomy and ensure they understand and agree to the treatment plan. This question emphasizes the ethical and legal importance of informed consent in healthcare. The concept is about respecting client rights and ensuring shared decision-making. Informed consent means the client has been fully informed about the proposed treatment, including its benefits, risks, and alternatives, and freely agrees to proceed. For example, explaining the type of massage, what areas will be worked on, and confirming they have no contraindications before starting. Always remember that informed consent is fundamental to ethical practice, empowering the client in their healthcare journey. Question 20. Which of the following best describes the purpose of cross-fiber friction massage? A. To spread lubricant evenly over a large area. B. To lengthen muscles and improve flexibility. C. To separate adhesions and break down scar tissue. D. To soothe nerves and induce relaxation. Answer: C. To separate adhesions and break down scar tissue. This question targets a specific advanced massage technique and its therapeutic application. The concept is about understanding the goal of friction techniques. Cross-fiber friction is a specific stroke applied perpendicular to the muscle fibers or tendons, intended to reduce scar tissue, prevent or break down adhesions, sticky tissue formations, and improve tissue mobility. For example, using a thumb to apply small, deep, back-and-forth movements across a tendon where an old injury has left scar tissue. Remember that friction is often used to remodel connective tissue and restore normal movement. Question 21. When a client expresses discomfort during a deep tissue massage, the most appropriate action for the therapist is to A. Encourage them to breathe through it and continue the pressure. B. Immediately stop the massage and end the session. C. Reduce pressure, check in verbally, and adjust the technique based on their feedback. D. Change the subject to distract them from the pain. Answer: C. Reduce pressure, check in verbally, and adjust the technique based on their feedback. This question tests client communication and safety during a massage session. The concept is about responsive and client-centered care. When a client expresses discomfort, it's crucial to immediately decrease pressure and verbally communicate with them to understand the nature and intensity of their discomfort, then adjust the technique accordingly. For example, if a client flinches during work on a tight hamstring, you might lighten pressure, ask about the sensation, and then slowly reapply pressure as tolerated. Always prioritize open communication and modify your work to the client's comfort level. Massage should never cause sharp or unbearable pain. Question 22. What is the proper term for inflammation of a joint? A. Myositis. B. Osteoporosis. C. Arthritis. D. Tendinosis. Answer: C. Arthritis. This question tests basic anatomical and pathological terminology. The keyword inflammation of a joint directly corresponds to the definition of arthritis. Myositis refers to muscle inflammation, osteoporosis is bone density loss, and tendinosis is a degenerative condition of a tendon, not necessarily inflammatory. For example, a client with rheumatoid arthritis might experience swelling and pain in their finger joints. Knowing basic medical prefixes and suffixes, like itis for inflammation and arthro-for joint, helps in understanding medical terms. Question 23. In what direction should effleurage strokes generally be applied to promote venous and lymphatic flow? A. Towards the extremities. B. Away from the heart. C. Towards the heart. D. Randomly in any direction. Answer: C. Towards the heart. This question focuses on the physiological principles behind massage application, particularly regarding fluid dynamics. The concept tested is how massage strokes facilitate the body's circulatory systems. Applying effleurage strokes in a centripetal direction, meaning towards the heart, helps to assist the natural flow of venous blood and lymph, which generally move towards the center of the body for filtration and return to circulation. For instance, when massaging the leg, strokes should move from the foot up towards the groin. Always remember to direct your strokes towards the heart to efficiently aid the body's natural fluid return systems. Question 24. Which of the following endangerment sites should be avoided or massaged with extreme caution due to the presence of superficial nerves and blood vessels? A. Quadriceps femoris. B. Olecranon process, posterior elbow. C. Axilla, armpit. D. Gluteus maximus. Answer: C. Axilla, armpit. This question tests your knowledge of endangerment sites, critical areas where deep or careless pressure could cause harm. The concept is recognizing vulnerable anatomical locations. The axilla, or armpit, contains superficial nerves, like the brachial plexus, arteries, axillary artery, and lymph nodes that are vulnerable to compression. For example, applying deep, sustained pressure directly into the armpit could cause nerve damage or temporary numbness. Always be acutely aware of endangerment sites and modify your techniques or avoid these areas to ensure client safety. Question 25. What is the most appropriate action if a client expresses that the room temperature is too cold during a session? A. Tell them the temperature cannot be adjusted. B. Offer them an additional blanket or adjust the thermostat if possible. C. Explain that cold temperatures are good for muscle relaxation. D. Ignore their comment and continue the massage. Answer: B. Offer them an additional blanket or adjust the thermostat if possible. This question focuses on client comfort and effective client communication, which are vital aspects of professional care. The concept is about being responsive to client needs. A client's comfort directly impacts their ability to relax and benefit from the massage, so addressing concerns about temperature is essential. Offering a solution, like an extra blanket or adjusting the thermostat, shows attentiveness and professionalism. For instance, having a warm blanket readily available for clients who feel chilly is a simple but effective way to enhance their experience. Always remember that creating a comfortable environment is key to a successful and therapeutic massage session.